Hello, everyone. My name is Dan Toner. I'm the health insurance broker for Alumni Staffing. I am here to talk about open enrollment for the company health plans, which runs, we're going to run it from Monday, the 29th of April until Wednesday, May 8th. So we'll give everybody a good week and a half to make your elections for this year. If you are getting this recording outside of open enrollment, you would probably be a new hire, and there's a 90-day waiting period, and then you can sort of proceed with the instructions that we're going to go over. I'm going to go over the 22-page memo as quickly as I can. My contact information is on the last page. My company is FFP, and that is me, Dan Toner. Amanda and Leslie are my support teams in case you need to reach us. So, quick overview, we are going to be renewing the existing medical plans. We're not making any changes to coverage. So there are 3 medical plans from Horizon that we're going to go over, and we are keeping the dental and vision plan from United Healthcare. No changes to the concepts. We have, for those that live in New Jersey and that see New Jersey providers, we have the Omnia Silver and Gold. I think they made some improvements on the deductibles and copays. I'm going to go over that with you briefly. For those that are looking to use providers outside of New Jersey or that live outside of New Jersey, we have what's called the Advantage Silver, and the word Blue Card is super important. That means you can see Blue Cross doctors outside of New Jersey. So you need to purchase the Blue Card. For those that are in the New Jersey only plan, you are covered out of state if you have an emergency. But if you want to see providers on a regular basis outside of New Jersey, you really need the Blue Card. Okay. I'm going to blow this up a little bit. And there's some detailed summaries here as well. On the 3 different plans, again, the first 2 are New Jersey only. The way that the Omnia programs work is Omnia has 2 tiers of coverage, tier 1 and tier 2. If you're using tier 1 providers, you will pay a lot less in cost, like a copay versus maybe a deductible if you go to tier 2. So the plan is incentivizing you to see tier 1 providers. And when you go on the Horizon website, I have some instructions in the memo. You'll be able to see how your doctor is classified. Either as a tier 1 or a tier 2. It's all on horizonblue.com. If you go to your primary care, you'll have a $25 copay. That is a lower copay. I think it was $30 last year. They lowered the specialist copay to $50. And if you're seeing at tier 1, you'll pay those copays, and then the balance of the office visit is paid at 100%. If you're using tier 2 providers, there's a $2,500 deductible and 50% coverage. So again, heavily incentivizing you to see tier 1 providers. The hospital and surgery and MRI deductible is $1,500. It was $1,800, so that's good news. Horizon lowered the deductible. You will see when you do things like hospital surgery or MRI, you will see copays that you pay after the deductible. So I'll give you a good example. If I had outpatient surgery, I would owe a $1,500 deductible and then a simple $250 copay, and the same $250 copay for the rest of the year. January 1, it's not June. Everything works on a calendar year basis. The deductibles reset. So if you've already met deductible starting in January, you don't have a new deductible. It started January 1 already. That's when you will meet the deductible, when you have those hospital surgeries and like MRIs. Okay. The main difference between silver and gold is you'll notice there is a lower hospital and surgery deductible for the gold than silver. You'll notice your doctor copays are less. And probably the biggest difference is name brand drugs are a copay under gold, where they're covered at 50% under silver. So if I have an inexpensive name brand drug, like it's $100, 50% would be $50 to me and $50 to Blue Cross. I may not need to spend the extra money to buy gold unless maybe my drugs were significant in cost. So that's just a little hint on the difference. One other thing to point out too, hospital and emergency room. The emergency room is part of the deductible. but the urgent care is not. It's a simple copay. So there's a big difference between that facility, the ER at a hospital versus going to an urgent care center. So just keep that in mind when you're looking at the plans. For those of you that want the national access called the Blue Card, there are no tiers. You'll simply pay $45 to see a Blue Cross provider, $70 to see a specialist. Your hospital, surgery, and MRI deductible, you owe a percentage of the bill, but you can't spend more than the maximum out of pocket. Keep in mind the maximum out of pocket is the sum total of all your copays and deductibles. For those in New Jersey, you may not reach this out of pocket because you have copays unless you're using a tier 2. When you owe 50%, you may be hitting the copays a little faster. Okay. I did put a note in here that remember your well visits are always covered 100% when you're using an in-network provider. I've given you a little summary here. So you can see another description of the silver, the gold, and the advantage with Blue Card. I give you some marketing material about from Horizon Blue Cross and all the products and services they offer for members. Just take a look at that. And I did show you how to look up your providers. If you're looking at the New Jersey Omnia plans, here's how you look up your doctors. And if you're outside of New Jersey, you're going to go to Blue Cross, bcbs.com, and you're going to look up the Find a Doctor area here. That's how you can look up to see Blue Cross PPO and EPO doctors outside of New Jersey. No changes on dental and vision. So this is a little summary description of the dental. You have 100% coverage for checkups, cleanings, exams, 80% coverage for surgeries and fillings, and 50% coverage for like crowns and bridges called major services. The benefit summary will be online for you to see. You can go in and out of network, but just keep in mind with dental that if the United is paying 100% of a checkup and a cleaning or an exam, and you go in network, they're paying 100% of a lot smaller number. So while you get 100%, if you go out of network, chances are your dentist won't recognize that cost, that fee, and they may charge you above. So again, heavily incentivizing, just like the medical has incentives, dental is trying to drive you to the in-network where you will pay less for each service. Another example is like a filling. If you owe 20% of a United dentist versus 20% of a non-United, your 20% will be less if you see an in-network participating provider. So you can go out of network, just understand you may pay more. And that holds true with vision as well. Okay. Cost to participate. In your first year, Alumni does contribute 50% of your single premium, and after 1 year of employment, they pay 50% for all your costs. And again, you'll see that when you log in to My Benefit Link. My Benefit Link is my FFP's portal. That's you communicating with me. My team looks at all your selections. If you want to cover dependents, we put all your benefit summaries. Everything's online for you to see. But more importantly, the site's going to be open for you during that open enrollment timeframe to enroll and make your decisions to enroll or waive. You have to do that online. For those that are hired as new during the year, you'll get a link, and then my team will call and set up an appointment with you to go over your benefits, answer any questions you have, and then we'll make sure you're enrolled according to your eligibility date. This is just a screenshot kind of showing you once you get in, how you can just click some buttons like modify, info to see benefits, compare the plans, but you're going to make sure that you select modify in order to get started on all these plans. In order for you to proceed and finish, you have to go to step 8, which is the signature, and then step 8 completes it. So please don't just make your elections on this page. Please go to the next page and make sure you follow it all the way through, and then you'll get a congratulations that you're done. Again, if you have any questions, there's some contact information from Horizon Blue Cross and United and our contact information here. So have a great day, and please let us know if we can help.